Hello, and thank you for taking a few minutes to learn about the Comfortcraft table with your clients in the prone position when they're face down. Now, one thing I really also like about the height adjustments is when someone comes in, especially if they have severe back pain, you can lower the table to a height where they're able to climb on and get themselves positioned on the table without having to get on some type of a footstool and climb up on a table, especially when they're in pain. So I'm going to adjust the height of the table, bring it up. Now there's only 4 pedals that you'll step on, so you'll learn your different pedals and you'll know which ones bring the table up and down and which 2 adjust the mid-split, bringing it up and down. And now that I'm talking about the mid-split, when the client's in the prone position, when your patient's prone, sometimes they're uncomfortable. And many times if you just add a little bit of flexion, you're going to see me opening that up here in the lumbar spine. That gives them a lot of relief. It stretches, it opens up these facet joints here in the back and gives a little aid and stretch to the body. And also, let's talk about the sliding face cradle, which again, it's like all face cradles, you're able to adjust the height and able to adjust the angle. What really makes this one unique, and I find very special, is that it allows the head and the cervicals, it allows the spine to lengthen. And that's very important during therapy for me, because as I'm working on someone, I don't want to be causing any compression of these of the foraminal spaces or jarring any of these joints together. I want everything opening and lengthening. So as I'm working on the body, however I am, and again, I'm able to adjust the height of the table so my ergonomics throughout the treatment are correct, where I'm able to line my joints up, use my body weight, and not injure myself during treatment. And at the same time, the clients will feel the lengthening. So I always point out these benefits of the table, the mid-split. I ask them to notice how it feels when I press on their back and their spine is lengthening, versus if I hold the face cradle in place and I press on their thoracic spine, they will feel that compression in the cervical spine. And I want them to recognize there's something different when they come into my clinic. And one of those, of many different things, but one of those is the type of table and all the tools that I'm integrating to get them well as fast as possible. Thank you for taking some time to learn a little bit more about the Comfortcraft table.